some of those folks don't recycle and they're not interested in recycling. It's our job to do this, what we're doing, going out, campaigning, not campaigning, but explaining what's going on, encouraging more residents to recycle so that we can get to that 62%, that 75%, or whatever the rate may be that we can recycle. We need to make this culture change in our society. Instead of throwing everything away, to look at recycling. And that's what we're here to do today. So very focused about the study.
I'd like to remind everybody, we are time limited tonight. It's 7:45. We will take the last question at 8:45. So I want to remind you, please try and keep your comments as brief as possible. If your question has been asked, you may consider deferring your response to somebody else. Again, also want to ask for continued respect. We are respecting your presence, your questions, your comments, and we just ask the same. Jessica Kramer, followed by Laura Mintz.
First, I want to emphasize this is not strictly a coal burning versus trash burning issue. There are lots of other cleaner, safer alternatives. Burning coal, not just burning trash. So I guess one of my questions would be, are these other alternatives being looked into as thoroughly as this particular project is? Also, I really want to emphasize more important, it's not a backyard issue that's going to just affect one neighborhood. Toxic heavy metals and other emissions like dioxin are bioaccumulative. They can travel for hundreds of thousands of miles without breaking down. Of course, there's a concentration where the emissions occur, so if all of the people living directly in the immediate area are too sick to work and their community gardens are growing too toxic to consume, there will obviously be a cost burden for all of the residents of Northeast Ohio. So along with the exorbitant rising cost of building this incinerator, the cost that is still unknown to us, have you studied the statewide healthcare and food assistance cost increases that will certainly result from the emissions from this plant? And if you have, where can we find those studies? Do you want me to start over? Just the very last part? Have you studied the overall statewide health care and food assistance cost increases that will result from the emissions from this plant? And if so, where can we find those studies?
I heard your last question was, have we studied the statewide impact of increase in food assistance and health impacts that this project would incur? And the answer would be no, we have not.
There was a couple of other questions. One related to the other opportunities, advanced energy, renewable energy opportunities. On slide 32, we made a reference to those. We're still looking at wind, traditional wind and offshore wind. We're still looking for solar projects. We currently are heavily investing in hydro projects. The answer to your question is yes, we definitely are. This is not a mutually exclusive opportunity. This is another way we're going to impact and reduce our consumption of fossil fuels. So it's just one of many efforts that we're taking. Thanks for your question.
Hi, everyone. I'm an MD PhD student in Healthcare Organization Outcomes and Policy at Case Western Reserve. What I'm about to say is not the opinion of Case Western Reserve, but it's my opinion as a resident of Detroit Shoreway. Better Health Raises Cleveland, which is a collaboration housed at Metro Health Medical Center, has fairly exhaustively talked about and cataloged the health disparities of people in Cleveland. For instance, we have a hospitalization for asthma rate that's 50% higher than cities of comparable size. We have loads of other healthcare disparities, and we could talk about what the origin of those are, but what we know is that we have a heavy burden of healthcare on the people of this city. And part of that is because lots of us, and I come from a steelworking family, both my grandfathers were steelworkers, were employed by industries that were extraordinarily pollution generating. And at the time, we didn't know what the impacts of the pollution were, and I would suggest that at the time, because right now, we don't know what the exact impacts of gasification are going to be. They are what Donald Rumsfeld has called unknown unknowns. And I think that when we're starting from a place of already being so far behind in our health, and as a future healthcare practitioner, I'm going to care for the people of this city who are already dealing with incredible amounts of illness. I think we need to be extraordinarily conservative in any extra generation of any new things in our environment that we don't know exactly what they're going to do. One other suggestion that I was going to make is that if recycling is a revenue-generating activity, one of the ways that healthcare economists would suggest we can improve our health is by incentivizing healthcare. So maybe we should incentivize recycling and kick back some of that money generated from recycling back to the citizens of Cleveland who are doing the recycling. Money's pretty motivating. That's all.
I just want to say that you bring up a very good point, and it's something that even though we are here explaining the proposed facility, I know that each one of us has thought about. We have a responsibility to balance all of our responsibilities as a city. One of the ways that we are looking to do that is this facility. We know it will be a new source of pollution in the city.
You got it.
I can tell you honestly, none of us, that's not our favorite aspect of this facility. We do know that it will reduce overall emissions. We do know that it will increase recycling jobs in the city related to the MRF and the citywide curbside pickup. And we also want to share with you that the City of Cleveland has an initiative called Healthy Cleveland, which really is designed to address many of the issues of healthcare disparities. So it may seem like these two projects, the Healthy Cleveland and the CREG Center, are in conflict with each other, but we are trying to do the best that we can in a whole systems way that manage all of our responsibilities. So as we go forward, continue our due diligence, we will be looking at the impact on the community, as we have already. We will be looking at those emissions levels, what we can do in terms of technology to reduce emissions, what we do to our feedstock, including pulling out the e-waste and other hazardous materials to make sure it does not go into that facility. It is a very difficult question to take, but it was a very important one, so thank you. Next is Marilee Santiago, followed by Nancy Demore.
Okay, I kind of knew with this, but the main concern to me is health, and I just can't understand how you can guarantee. I live on 103rd, which is like right there, basically a couple streets away, and then there's the pollution, and this is all major concerns. But then there's things that people haven't said, like we work hard to pay for our houses. Our taxes go up. We have to pay for garbage. So what about property value? You know, like you want to sell your house, as in my case, I'm aging, maybe later for one. Somebody sees this, do you think that's like, oh yeah, I really want to buy a house here? I mean, that's like at the bottom of the list, but this is full circle because as you're talking about spending our money for this stuff, I'm aging out. I've raised my kids. My grandchildren live with me. You know, I don't understand. I guess my question is, it's a full circle thing. We're paying, we're paying our house payments. We're paying everything. And then, when it comes our time to maybe move on, how is that going to work for us? Let alone the health care.
great question. Great question. The impact on the community around facilities like this and the property value, certainly an important one for folks who live around it. I can share with you the experiences I've seen and observed. I can tell you the people that I've talked to that work and live around the gasification facilities that we've seen firsthand compliment it. They're very positive about it. They're a good neighbor. They're not complaining to us. They could have. They had opportunity to tell us what they really felt, and they only said really good things and supported it. The property value, these facilities are well designed and well kept, well maintained. They're very clean. They have no bad odors. They have no bad smoke or gray comes out of it. And so what happens in most of these areas that I've been to personally is that the neighborhood supports and complements.
Thank you. Ms. Santiago, are you still with us? Next is Hank Haberman, followed by Molly Lutz.
Certified permaculture designer, which means that I'm actually certified to think about full systems approaches to dealing with waste management and respecting the environment and the people involved with it. One of the most, first off, I'd like to talk a little bit about pyrolysis. Pyrolysis to me means the technology that saved Caribbean children from breathing in harmful gases. Pyrolysis was designed as a technique for combustion so that in the Caribbean, where they mainly use char as a fuel stock, they were making char in a way that created lots of methane and pyrolytic gases that went straight into the lungs of the children. And pyrolysis was created as a two-chamber combustion method that was simple enough to put in a coffee can, so that the women and children that were making the charcoal in the Caribbean wouldn't have to deal with those pyrolytic gases. And they solved a huge public health crisis in the Caribbean using these little tiny pyrolytic chambers. So the technology has been around for a long time, and it's great when it's used appropriately. So one of the things that there's two ways that this doesn't seem like whole system thinking to me. The first is considering the appropriate feedstock to use within the system. I think a lot of the concerns from the neighbors and the community would be solved by using the appropriate feedstock. The lowest cost for recyclable material, the one that the city would be paying the most for, would be paper and cardboard. Now, if that's the majority, when you look at the whole perspective on paper and cardboard, trying to recycle it is worse for the environment than just making new paper. Trees are a renewable resource. When you take a tree and you make it into paper and then you find a way to put the paper into soil, it is carbon negative. It's pulling carbon dioxide out of the atmosphere. So one way is composting, another way is a pyrolytic combustion that's extremely clean. Now, in order to do a pyrolytic combustion where you could actually put it back in the soil and think it's safe, you would need to treat. You would need to have a good, reliable feedstock, and then you would need to take the byproduct and treat it appropriately. The easiest way is with what you've already got.